This is what I see.
This is what I see.
It's what I see. Me too.
But what we can't see is a dentist.
It's true. We don't have enough dentists in our state. But it's not for a lack of trying. From strong support of our safety net clinics to the Dental Hub program and the extended care permit for dental hygienists, Kansas lawmakers remain dedicated to solving the shortage of dental professionals in our state.
You talk about progressiveness in Kansas. Kansas has a strong progressive history. The extended care permit is very progressive. So we provide services in schools, Head Starts, WICs, long-term care facilities.
We're able to go see the nursing home patients. We're able to get in there and see the kids that qualify for free and reduced meals, but we're not able to diagnose. We're not able to do anything about it. They're in pain, but we can't fix it. If you had the dental therapist, you could go there, see them, have somebody in pain, and do something to make it better at the same time. And that truly would be the best situation.
The families that want this care have nowhere to go. I'm already out there. I am doing their cleanings and their sealants and their fluoride. I already have my hands in their mouth.
We've come together before as a state with the extended care permit of people, of dentists and dental hygienists and advocates and politicians, and all of us have come together to fix that. Why can't we do that again? I think we can.
The extended care permit isn't the only way Kansans have worked together to increase access to health care. Over the past several decades, Kansas has introduced mid-level providers, like nurse practitioners and physician's assistants, on the medical side. These professionals have played a critical role in improving the overall health of Kansans, keeping medical care accessible in our rural communities, and being a key player on the medical team.
The medical profession went through the same problem. The physicians fought the idea of having nurse practitioners and physician's assistants in their practices. And once they gave up on the idea that it's not competition, once they gave in to the idea that this is something that's good for the community and good for patients, what they realize is, wow, this is a valuable part of my practice.
We also have fully utilized the mid-level professionals on the medical side. Without the mid-levels, we wouldn't be able to see the volume of patients that we see.
Most of the physicians that I know and I spend time with, and certainly the Community Health Center here in Southeast Kansas who have nurse practitioners on staff, realize that they're a very integral part of the healthcare team. Just as a dental hygienist is a very integral part of the dental team, just as a mid-level provider can be a very integral part of the dental team.
The mid-levels tend to see more people than the physicians, and the reason why is because the physicians oftentimes are dealing with the more complex patients, the patients that have chronic conditions, that have multiple diagnoses going on. So the mid-levels actually enhance the services that we provide because they're able to do a lot of the things that we need, but then the things that they can't do, they free up the physician to be able to do.
I know what a hygienist can do in my practice concerning periodontal disease, patient instructions, getting children motivated, getting adults motivated to take care of their teeth. If I had a mid-level provider, somebody who was skilled to do fillings, per se, simple restorations, pulpotomies on baby teeth, chrome steel crowns, remove baby teeth, then that allows me to focus more on and see more patients who need, children who need endodontic care, root canals.
Kansas has an opportunity to take the next step and implement a long-term solution to our state's dental shortage. By permitting a mid-level provider, known as a dental practitioner, to practice in Kansas, we can address access problems to dental care in the same way we've addressed access problems to medical care in our state.
The best way I think to do it is have a mid-level practitioner who can extend their care, who they supervise, who they review charts on, but who can do simple procedures.
We're not the only nation that has faced this. So we know the model works. Canada proved it, Alaska's now proving it. They've had their program in place for a few years now, and what we're seeing is the standard of care is extremely high for mid-level providers.
It is successful in other countries, other states. There's a lot of fear of the unknown, but fear can't get in the way of progress.
As the dental shortage continues to worsen in our state, we need to get serious about making progress. If we wait, we run the risk that it will be too late, and more Kansans, even those with private dental insurance, won't be able to find a dentist. Dental practitioners could never replace dentists, but they can handle some of the routine procedures, freeing up our dentists to focus on the more complex procedures they were trained to do.
It extends our doctors. You've got nurse practitioners and PAs, and a lot of us get our health care from them, and we trust them. So it makes the limited doctors we have go farther. So your workforce problem becomes a lot less of a problem with the dental therapist model.
The problem's there now. What's it going to be like in 5 years? What's it going to be like in 10 years? If we don't act now, we're going to act when it's almost too late.